Good evening, dear friends. Thank you for your interest, and I also congratulate you on any holidays you might be celebrating right now. And of course, enjoy your meal to everyone who is eating right now. Interesting topic. Why do joints crack? Want to find out. The cracking can be related to a disease, or it can simply be because you haven't moved for a long time. You've been in one position for a while, and when you make your first movements, something cracks somewhere, but nothing bad has happened. But if you move your arm or leg or turn your head and you hear a crack every time you move, that's already a red flag. It's a warning sign. These are signs that joint osteoarthritis has either already started or it's quietly sneaking up on you.
Hi guys. The doctor recommended me a great blood pressure monitor. Easy to use at home, accurate, and reliable.
So, today we're going to learn about joint cracking. When should you be worried? When is it dangerous? And in what cases will it just keep you from sneaking up on someone? So, friends, there are several types of joints. Some joints are more complex. Some allow for a wider range of movement, and there are simpler joints where movement is basically limited to one plane, like in your fingers, bending and straightening. The elbow is a bit more complex. Besides bending and straightening, there are also these two movements. They're called pronation and supination, which are rotations around the axis. There are even more complex joints with a greater range of movement, like the shoulder joint and the hip joint. Because the socket has a ball-like shape, you can rotate your arm or leg in different directions. And the more varied the movements in a joint, the higher the chance that different clicks or popping sounds may occur during movement. But this often happens with the shoulder and the hip joint. There is functional crepitus, which is not dangerous, but it is related. It usually happens during movements and during movements that are not typical for you, or when you have been in the same position for a long time, lying down or sitting, and then you make your first movement. And at the same time, something there might crack, or you move in a range of motion that is unusual for you. Also, if something cracks there, even in your back, you can turn in such a way that something cracks when you turn one way or the other, and it seems to feel a bit better. That's not dangerous either. It's just because you're moving the joint in a range that's unusual for it. There just wasn't enough synovial fluid in the joint for that movement. It increases gradually. After you crack it once, it won't crack again when you move. Nothing bad happens. But there's another more dangerous kind of cracking, which may not mean you already have osteoarthritis, but that it's slowly starting to develop. What is osteoarthritis? It's a degenerative change of the joint surfaces, a degenerative change of the joint. The joint itself consists of several parts. Two bones covered with cartilage. These are the articular surfaces. This is surrounded by the joint capsule, and the capsule is reinforced by the ligamentous apparatus. And all of this is controlled by the movement of muscles. In some joints, for example, like in the knee joint, there are also intra-articular structures inside that provide congruence of the joint. What is ITA? A complicated word. It means that the two articular surfaces themselves do not quite match each other in shape. And that's why there are also cartilaginous structures there in the form of meniscus. They are present in the knee joint, and there is also one in the temporomandibular joint, where there is an articular disc as well. And because of various reasons, there can be mechanical reasons, trauma,
uneven load on different parts of the joint, impaired stabilization of the joint by muscles, overload, lack of load, poor nutrition, and various diseases.
Well, you could say systemic reasons like osteoarthritis, for example. All these diseases, they eventually lead to the fact that this joint surface, this cartilage, for some reason, there are many different reasons, it starts to thin. The nutrition of this cartilage is disrupted. Various erosions appear there. It becomes rough in general. That is, the integrity of such cartilage is disrupted. And this is exactly the first stage of arthrosis. The joint space narrows. Normally it's filled with synovial fluid, but this gradually decreases. And the two joint surfaces start to rub against each other excessively. There's not enough synovial fluid. And because of this, a pathological crunch appears, which is dangerous and happens with every movement. That is, you make any movement and there's this unhealthy crunching sound. This is a sign that osteoarthritis is already slowly starting, but not always. For example, if this happens in the knee joint, it's often because of the kneecap. You see, here it is this little bone right here. It starts to get almost too close to the femur. And you could say it starts to scrape against it. That's how it happens. This is due to the shortening of the rectus femoris muscle, which causes limited mobility of the patella. Shortening of all of this, all the soft tissues that surround it. So, friends, what do we need to do to avoid all of this? We need to prevent the development of arthrosis at the early stages. How can we restore? How can we get rid of these aches? Because, well, of course, they might not be dangerous, but in the long run, it means that nothing good is happening to you. When you have constant, probably cracking sounds from them. At the stage of functional changes, we can completely stop the development of arthrosis. And if you have cracking in your joints, well, let's break it down. Let's talk about the most common places where it cracks most often. Let's take the hip joint as an example to start with. It often cracks when you rotate it. So, when a person rotates their leg like this, it's often the case that when they lift their leg, move it to the side and lower it, they get a click in the hip joint at the moment of lowering. So, here we'll divide the muscles into 4 groups. There's a group called the adductor muscles, which perform this movement, bringing the leg back to the center. When they contract from the abducted position, they bring the leg back from here. The muscles opposite to them are the abductor muscle group. They perform the opposite movement. So what do these two muscle groups do? Some abduct, others adduct, abductors and adductors. There are muscles that flex the joint, that's this movement, and the opposite movement extends the joint. And there are 2 more groups of muscles. Some will turn the leg out this way, others will turn it the opposite way. This is external and internal rotation of the joint. We just divided them into groups. Some of the muscles can participate in several movements at the same time, like for example moving backward like this. Yes, that's our gluteus maximus. The piriformis, which is also involved a bit, and at the same time, when turning the leg outward like this, the gluteal muscles will also be involved, so they can make various movements. And in the hip joint, here 2 imbalances arise. One is between the muscles that adduct and those that abduct. And the second is between the muscles that flex and those that extend. Some of them become too short, while others become too weak. Here, in our case, with the forward and backward movement, because of our lifestyle, because in recent years we've been sitting a lot. Here we will have to stretch the muscles on the front of the thigh and tone the gluteal muscle the middle gluteal muscle, and you can check by rotating your leg. If you hear a click, try to do what we're about to do and then check again. If the click becomes less noticeable, then you're on the right track. That if after we do this, the clicking gets worse or you start to feel pain when it clicks, then you're out of luck. What can you do? You'll need to try something else, but we'll talk about that next time. But that shouldn't happen, I think. But let's see how it goes now. But so, for the hip joint, the first thing is to lie on your side, on the middle gluteal muscle. We'll add some load. But lying on your side, start lifting your leg. Lift up, lower down, lift up, lower down. 10 repetitions, 2 to 3 sets. Well, start with 2 sets. First position. Second, move your leg slightly forward. You can even let it hang off your bed or sofa, whatever you're lying on. Like this and like this. In this position, lift your leg as well. Second position. Third, bend your leg. In the bent position, lift and lower it. Third position. Fourth, put your feet together. In this position, lift and lower them. Try not to help yourself with your pelvis like this. That is, do it only by moving your leg. This puts a load on the gluteus medius and partially on the gluteus maximus muscle. Repeat on the right and left sides. Do it on both sides and then move on. Let's stretch the muscles on the front of the thigh and the iliopsoas muscle, which when shortened cause the joint surfaces to come closer together. To do this, place one leg forward and the other back. Lean forward, shifting your weight onto your front leg. You should feel a stretch in the front of your thigh. There shouldn't be any tension in your lower back. And just like that, slowly stretch, relax, relax. Also, if you do it on both legs at once and train, stretch like this on the right and left sides. Repeat the movement 10 to 15 times on each side. Next, after that, you can put some load on the gluteus maximus muscle. So you immediately stretch the front of your thigh, and right from here, you lift your leg up. Back here at a 45-degree angle, just like this. This is the hip joint, And further on, again, the hip joint continues. What else can get shortened here? The back of the thigh can sometimes get shortened, and the piriformis muscle as well, especially when the gluteus maximus is weak. The piriformis muscle can be stretched in several ways. Yes, there's a method where you don't have a strong initial shortening. For this, you place your leg higher on some kind of elevation, and from this position, you lean forward. Right here, you will feel the tension in your glute muscle. The more you lean forward, the more it will stretch. However, if you can't do that, then start with a chair at first. Sit on the table, put your leg like this. If your shin doesn't become roughly parallel to the floor, then stop at this stage and press a little on your knee here. Try to further increase the mobility in your hip joint. If you manage to position your leg roughly parallel to the floor, then you can slowly start leaning forward and you'll feel a stretch in your glute area. That's your piriformis muscle stretching, and you need to keep it in this elastic state. Because when the piriformis muscle shortens, very often, besides the sciatic nerve, the gluteal nerves also start to get compressed, the superior and inferior gluteal nerves. So is this the kind of lean you're doing? And if you feel tension in the piriformis muscle, it means there's a slight shortening, so it's worth stretching it out. So friends, Friends, we've just covered the basics of the hip joints together. Also, if you felt tension when you were stretching the iliopsoas muscle, if it was pulling quite strongly, check if you have shortening of the rectus femoris muscle, because often all of this goes together. For this you do a similar movement, but now look, put something soft on the floor here so you can put your knee on it. Place your knee on the pillow like this. It's a similar leg position. Your leg is in front, and here you start to shift a little forward so you feel a stretch in your thigh, the front part of your thigh. You stretch the muscle, then relax it. Stretch it, then relax. Move your pelvis slightly forward. Repeat this on both sides. Thigh. This also helps increase the mobility of the hip joint and eliminate clicks, not only in it, but also in the knee joint of the thigh.
So, what's the point? If the stabilization of the joint by the muscles is disrupted, some muscles are better developed, some are weaker. Then, during movement, there is uneven contact between the two joint surfaces.
In certain positions, they get closer to each other, then suddenly move apart, and that's when this crunching effect occurs. We just discussed the example of the hip joint and what can be done about it. You can do pretty much the same thing with the shoulder joint. Here, in addition to that, we need to see which part of our deltoid is better developed, the front, the back, or the middle. Besides that, there are other nearby muscles involved here as well. These are the pectoral muscles, both major and minor. These are the muscles that also stabilize the scapula from above, below, and here near the spine. And that's why it's a bit more complicated here. Here, besides looking at how the muscles that move the joint itself work, you also need to look at how the muscles that move the scapula work. If you're interested in this topic, show it by leaving comments. I'll see how interested you are, and then I'll decide whether we'll go over this together or not. We'll talk about something else next time. Well, what can I say? Write down who's here. From the viewers, from the regular commenters, Koas Nustrei Evapsh. It's been a while since we did a roll call with you. But how are you feeling overall? In general, don't hesitate to write in the comments either. We will thank you. Now we'll be acquainted. Thank you.